Public Health Director James Gillen says over 3,000 people on Guam could be eligible for medicinal marijuana. And with this many people, there's potential for millions of dollars in revenue.
We had estimated and this was just a guess, okay, guessing the street value or the street price of an ounce of marijuana, the number of patients who might be able to use it. We estimated $90 million in gross revenue if it's at $500 an ounce.
But in order to get there, public health has to develop the rules and regulations needed for the implementation of the new law. Gillen says the first draft of 133 pages was recently completed.
This is the first draft, okay, and it'll be one of many. This is based primarily on what we could get from the state of Arizona. Made some changes in order to make it fit the Guam situation.
As we have reported, Gillen is working with Arizona's Department of Health Services on the web-based application system. He wants to model medicinal marijuana after Arizona, as he believes it's been carried out in the state efficiently. While Gillen has 9 months from February to promulgate the rules and regs, he hopes to do it before then. And along with the advisory board reviewing the draft, he'll also be getting feedback from various stakeholders, such as the Guam Police Department.
We do have stakeholders who are affected by this. We're thinking about the police department alone, having to probably follow, when they encounter somebody who they suspect is under the influence of either alcohol or drugs, they're going to have to, do some testing. And what we find is they have no equipment right now to do any street testing for marijuana, because it is clear in the law that if you're found DUI, that's not an excuse. So we need to see what they're going to need in terms of equipment to do testing.
More than 24 stakeholders will be distributed the draft rules, including Rev and Tax, the courts, insurance companies, Guam Hotel and Restaurant Association, Guam Customs and Quarantine Agency, the Guam Medical Association, and of course, the Guam Legislature. Gillen says he initially thought implementing medicinal marijuana would be fairly simple, but has since realized it is not.
It's important because we have to start somewhere, obviously, okay? And this is, borrowed from a program that's worked. It's not perfect. Getting as many people who are affected by this involved in, again, tweaking it, refining it, is very important.
He adds getting the feedback will also help determine what will be considered an adequate dose to distribute. The stakeholders will be given the draft rules within the next week. Gillen says in the meantime, 3 people from public health will be going to Arizona in May to learn about the software and source code needed for Guam. Reporting for Guam's News Network, I'm Ken Quintanilla.